and I'm Victoria, Human Resources Manager here at White Oak Transportation. And I just want to thank you for taking the time today to review all of the changes that we have planned for 2019 that we can expect during open enrollment. First thing that you're going to notice is there is a packet of notices. Everything from Affordable Care Act notices to information about our 401k. We are required by law to distribute all of those, so that's just a great time to do it. Saves us the postage. The other thing that you're going to notice is there is an authorization to receive your payroll via email. Rather than receiving your statement showing how much you were paid and what runs you were paid for in the mail to help save postage, we've made it optional that you can receive your payroll statements by email for those of you who are currently enrolled in the direct deposit. You have the choice that you can either go ahead and sign up for it, or you can initial that you want to have it remain the way it is right now, and that you'll continue to receive it at the mail. At this point in time, it's not mandatory to move it to email, but it's definitely something that we're working towards. So basically, at this point, everybody wants to know about what the changes are for 2019 to the benefits package, so we're just going to get down to it. The first thing that you're going to notice is on the Blue Cross Blue Shield that we are no longer offering Employee Plus One. The employee and family will remain the same prices that we had last year in 2018. Since January, we have seen our Blue Cross Blue Shield rates increase, and one of the ways that we've discovered that we can reduce our cost and employee cost. Blue Cross Blue Shield ran the numbers, and we were able to hold our premium steady for 2019. So anyone, if you are enrolled in employee only or in family coverage, your premiums for healthcare will not increase in 2019. If you are currently enrolled in the Employee Plus One, January 1, you will move to the family coverage rate. It's just a way for us to try to keep the majority of the covered employees at a reasonable weekly premium price. The other way that we've noticed, every year we get a report from Blue Cross telling us what our utilization has been. Another way to keep them low for next year is to encourage your physician to please request generics from them. Generic medicine works exactly the same way, provides the same clinical benefits as brand names. It applies to all FDA approved medications. So a generic medicine works the same way: dosage, safety, effectiveness, strength, stability, quality. And it's just a really good way to, number one, you're going to reduce your copay that you're going to pay at the pharmacy. Secondly, it's going to help reduce our cost on our end and help to keep our healthcare costs lower. White Oak is committed to offering all of our employees a quality healthcare option with affordable deductibles and a low weekly cost compared to other companies of our size. And we're going to continue to do that into 2020, and any way that we can help keep our costs lower, we'll share that with you. Speaking of quality options for our employees, we are really happy to announce that big changes are coming to our dental and vision. Our dental is new and improved, the vision is new and improved, and White Oak Transportation is going to cover 100% of the cost of the employee-only coverage with severely reduced rates on anything for dependents. When you attend, you will receive a new booklet from Guardian. Don't really want to get into the whole thing, but we are changing our dental to a single plan. All preventative care, same as it was with our other plan, is covered at 100%. The difference is that basic care will also be covered at 100%. So, fillings, extractions, even surgical extractions, you're not paying an 80-20 or a 70-30 anymore. The procedure will be covered 100% by the insurance. It also increases the annual limit to $2,000 from the $1,000 and $1,500 that we did have. And we're also seeing that there is lower cost on the Employee Plus One and the family coverage with this new plan. So depending on what your plan was in 2018, you may see lower cost with increased benefits. One of the downsizes, although all employees are covered at no charge to them, there is the loss of the orthodontic coverage. So if you are currently utilizing orthodontics, make sure that you get all of the billing taken care of before the end of 2018, because it will be changing. As well, with the dental, we also have the vision coverage is also changing. So just like the vision, you will be covered at 100% of the premium. All employees will receive the vision coverage at no charge. That means that Employee Plus One and family coverage will be cheaper in 2019 than what you paid in 2018 for weekly premiums. We are moving to a plan that will not only cover your exam and your lenses annually, but will also cover frames annually. The old one that we were on would only cover frames every other year, which nobody's going to hand over their glasses and decide that they can go without them for for a week or two while you're getting new lenses put in your frames. The vision changes also include progressive lenses. We always had the single, bifocal, trifocal, but progressives were not covered. They are now covered, as well as transition lenses, the ones that you go outside and they turn into sunglasses, come back inside, and they come back up. Those are now included, as well as diabetic eye care. All right, so that's it for the dental and vision changes. Like I said, you will receive a new booklet. All right, flex spending. For those of you who currently have flex spending, there will be a re-enrollment in your packet when we sit down and meet. The increase for medical out-of-pocket expenses will be $2,650 for 2019. Up $50 from the $2,600 last year. For those of you who don't know what flex spending is, basically this is a way to set aside a small amount every week to be put aside to be used for medical expenses that are not covered by your insurances. For example, although our vision plan covers a new set of frames every year, if you do not want to choose from the ones on the rack that would be covered by the insurance, and instead you want to go with a designer frame, there's going to be a little bit of difference that you're going to have to pay between what the insurance will cover and what the cost is at the optometrist. So this is a good way to set aside some money, especially if you're doing contacts and glasses. Obviously, it's only going to pay for one. Ways to pay for co-pays, doctor's office, that $35 out of pocket. This is a way to set aside money for those types of expenses, deductibles, co-pays. The advantage is that flex spending money is pre-tax. This is a pre-tax deduction, so you are not paying taxes on the money that is put aside for this purpose. So rather than having to work to earn, say, $115 or $120 to pay for those designer frames that they're asking you to fork up $100, because it is pre-tax, you're just working for that $100 and paying them the $100. I'll have the enrollment to be able to answer any questions anybody has. The disadvantage is that if you choose to do the maximum amount, which is $2,600, and you do not use it all by the end of 2019, only $500 of that will roll over to be able to be used in 2020. So we have to keep that in mind when we're thinking about how much exactly we want to go ahead and set aside. There will also be the opportunity to add or make any changes to any of the coverages that you currently have. So if you've not added short-term disability and you'd like to, if you currently have just vision on yourself, but you want to add your whole family, you have the opportunity to make any changes that you want to your benefits during the open enrollment period. There are a few coverages that you do have to fill out evidence of insurability form, like life insurance or long-term disability, if you do not take it during your higher period. So if that is something, I will have all of those forms with me so that we'll be able to make sure that we can get you covered. Lastly, the last thing I want to address is our annual employee survey. We've done this for the past couple of years, and we're going to do it again. The big difference compared to how we did it in the past, where you'd fill out your form and fold it up and put it in the big box that we had. Basically, this time, this is your opportunity to speak to our CEO, Mike Limbaugh. He is interested in hearing from what drivers think about whatever the subject matter is. Nothing is really off topic. He's just looking for good, honest, candid feedback, whether it's something that's good or bad. He just wants to know how things are going, if you have suggestions on how to improve something, if you've had a great experience and somebody was really there to help you out, or went above and beyond. He wants to know that as well. So any accolades or concerns that you bring up will all be noted and addressed. This will come specifically to him. Like I said before, we had the box. You put your survey in it. This time you're going to get your survey along with a self-addressed stamped envelope. Complete your survey at your leisure. You do not have to do it while we're sitting there doing open enrollment. You can take it home, have a chance to kind of think about it, fill it out. Down here at the very bottom, there is the comment section. That's when you can make comments about whatever the situation is. This is 100% completely confidential. You do not have to give your name. If you do, however, put your name and your phone number at the bottom. If it's something that is, brought up that needs to be addressed, Mr. Limbaugh himself will be in contact with you so that we can get some resolution. Basically, we spend a lot of time, effort, energy, money getting employees through the door, and we want to make sure that this is the place for you and that you're going to stay. And if there's a problem that we are unaware of, this is our time to find out. So no retaliation to any comments. He just wants to hear directly from you. He values your comments, good or bad, and just thanks you in advance for your participation. Well, after about 14 minutes of talking, evidently I'm becoming tongue-tied, but I do want to thank you very much for taking the time to do this. Be on the lookout for emails, text messages, phone calls, notices from your dispatchers. If you're down in Coleman, be looking for notices posted as to when exactly we're going to be doing the open enrollment. Always try to make sure that we do it during times that it's not going to affect operations. It's not going to affect your paycheck. We're not going to keep you from running. So we do a lot of Friday afternoons, Saturdays, on the weekends so that we can keep everybody rolling and making money, because that's what it's all about. Thank you very much for your time. Have a great day, and I look forward to seeing everybody during open enrollment.